Welcome back to Friends at 5. The news of former President Joe Biden's prostate cancer diagnosis is now leading to questions from some wondering about treatment options and asking if it's an aggressive disease. And here to answer all of our questions is Dr. Lee Hewgar with Lexington Urology. Thank you so much for your time. I want to get started by hearing your explanation, because when we found out this news yesterday, the administration for former President Joe Biden, they announced that his prostate cancer was graded with a Gleason score of 9 out of 10. So for all of us out here who are wondering, what the heck is a Gleason score? Break that down for me.
So the Gleason score describes the grade of the cancer, and the grade basically tells you how aggressive the cancer is. Gleason scoring is a little complicated. The pathologists, the doctors who look at the tissue under the slides, will find what the cancer looks like, give it a number, and then they find what it looks like in the second most common area and give that a number. They add them together and you get the Gleason score. So former President Biden's Gleason score was 9, either a 4+5 or 5+5. Over the years, it's become simplified a little bit. And so when I talk to patients about prostate cancer, I use a grade group, which basically takes those two numbers and normalizes it on a 1 through 5 scale, with 5 being the most aggressive grade of cancer. And so a Gleason 9 would correspond to a grade group 5, which is the most aggressive type you can have.
And we've heard that it spread to his bones.
Correct.
How common is that for it to spread? Well, and tell us what that means when you hear it spread to the bones.
So that means it's metastatic. It is not curable at that point. More aggressive prostate cancers can spread to the lymph nodes and the pelvis. The lymph nodes are little glands that tend to be the first places that prostate cancer drains to. But once it metastasizes or spreads, the bones are the most common site for spread.
What are the treatment options then for this stage?
So this treatment at this point is systemic therapy. And the cornerstone of prostate cancer treatment is something we call androgen deprivation therapy, or ADT. Basically, testosterone acts as fuel for prostate cancer. And so in the 50s, doing studies on dogs, urologists basically learned that by depriving testosterone, you can prevent the cancer from progressing. And so that's been the mainstay of prostate cancer therapy for a long time.
So what are your top 2 recommendations when it comes to screening guidelines for men who are watching?
Yeah, it can be scary when you hear something like this. And when it's in the national media, it's a good time just to review it as a public service. Most men should be screened starting at age 55, and screening is really simple. It's a simple blood test. People who have a strong family history of prostate cancer or are of African American descent should consider getting screened earlier, as early as age 40 or 45. And basically following the PSA over time is a really good way of determining if it's within a normal range and behaving as you'd expect, or more concerning for cancer.
Is there one takeaway overall that you want people watching this and hearing about the former president's diagnosis to walk away with, I should say?
I would encourage people to talk to their family, especially men should talk to other men in their family. It's something that men don't discuss very often, their own personal health. It's important to know what other health conditions your father, brothers, uncles, what they have, what they've dealt with. Because when it comes to prostate cancer, having first-degree relatives, brother, fathers, is a major risk factor. Mm-hmm. And so knowing that about your family will help improve making your own treatment decision-making.
Thank you so much for joining and sharing your knowledge with us, because it could potentially save a life, so we appreciate that.